People don't like their private insurance companies. They like their doctors and hospitals.
There are a couple new polls out that show us Bernie Sanders is the only candidate to trust when it comes to the issue of healthcare. The second poll in particular, I think, really showcases that. But this first one, I thought the result was obvious. Maybe you will think it's not as obvious, but CNN poll, Democrats see Sanders as the best to handle healthcare. So the reason I think that's obvious is because Bernie Sanders has been the one hammering the issue of healthcare. He's been the one informing Americans about Medicare for All and how America is the only developed country without a universal healthcare system. So to me, it just makes sense that Democrats would see Sanders as the best to handle healthcare. But then again, I mean, when it comes to the media and how they portray him and Medicare for All, I guess you can see a scenario where people might not think that. But that isn't even the poll that I find the most interesting. What I find the most interesting is the next poll that I'm going to get to in a minute. So let me set it up. There is this narrative that, well, if you tell the American people, sure, Medicare for All polls very popular. The majority of Americans want a Medicare for All system. But if you tell them that with a Medicare for All system, they're going to lose their private insurance, well, all of a sudden, they don't want their Medicare for All system because they love their private insurance company. But you didn't tell them that when they lose their private insurance, it's replaced by a better insurance. It's replaced by Medicare for All, which guarantees them more, which has no out-of-pocket expenses, which allows them to move jobs. Maybe they want to leave their job. Maybe they want to start a business, but they're afraid to because they have great health care through their employer. I mean, there are endless benefits to a Medicare for All system that obviously is not communicated through a poll. So before I get to the poll, let me just show you a clip here of Bernie in the debate making the same point that when you tell people what they actually get, how they really aren't losing anything with Medicare for All, then people would love it.
You know, Mike, Medicare is the most popular health insurance program in the country. People don't like their private insurance companies. They like their doctors and hospitals. Under our plan, people go to any doctor they want, any hospital they want. We will substantially lower the cost of health care in this country because we'll stop the greed of the insurance companies and the drug companies.
So I thought that was a point that needed to be made in that debate. Now, again, to me, this is obvious. Maybe it's because I'm in Canada and I have healthcare, so I already know all of these things. But it had to be made because people, for whatever reason, I mean, if you're polled on healthcare about Medicare for All and you're told that you lose your private insurance with Medicare for All, you should assume that you're going to have the Medicare for All. I mean, that's why you're losing private insurance. But it oftentimes has to be spelled out for people because people aren't really engaged in these issues. So you have to actually tell them what they're going to get or what they're not going to get, depending on whatever system. So finally, there is a poll out that asks voters this very question, asks them or tells them that, do you support Medicare for All if you lose your private insurance, but it allows you to keep your doctor and your healthcare providers? Well, here are the results. Majority of voters support phasing out private plans if they can keep their providers. So looking at the dark blue bars here, a Medicare for All system that diminishes the role of private insurance but allows you to keep your doctor and hospital. All voters support it with 55% support. Democrats support it with 78% support. Independents support it with 56% support. And Republicans are still brainwashed by conservative media. But this is the poll we've all been waiting for. Finally, an honest poll about Medicare for All. That, yes, when you lose your private insurance, you can still retain your doctor and your hospital because a Medicare for All system puts everybody on the same plan. So why would you lose your doctor? You wouldn't. But again, a lot of this stuff has to be actually communicated to people for them to get it. So under Medicare for All system, there is just endless benefits. And every time I talk about it, I forget things because, again, I live in the system. So it's hard to really remember all the benefits because I don't have to think about healthcare ever. It's never on my mind because when I need it, it's there. So under Medicare for All system, again, you're not stuck to an employer. If you have healthcare through your employer, you no longer would through a Medicare for All system, and you are free then to maybe leave your job if you don't like it, maybe leave your job if you want to start a business, or just do whatever. So say you want to do a completely different career path, but you have great private insurance, you are now free to lose your job and still have health care. It's free at the point of use. Again, no out-of-pocket expenses. It's for 99% of people will cost less through your taxes than you currently pay to a private insurance company. So this point is important because a lot of people think, oh, my taxes are going to go up. It's going to cost me more. Yeah, your taxes are going to go up, but you're not going to have private insurance anymore. So you'll actually be paying less, way less through your taxes in most cases than you would be to a private insurance company, unless you are the wealthiest. So if you are in the top 1%, you likely will be paying more through your taxes to help the rest of the country out, because that's how societies exist. Taxes pay for the things that we need to create a society, a healthy, vibrant society that we live in. So if you're making millions and millions and millions of dollars, hopefully you're okay with paying a little bit more in taxes so that everybody else in the country has health care. And overall here, it cuts down costs across the board. So because everybody's on the same plan, you take out the profit-making middleman, the cost of healthcare is down across the board. So these are just, again, a few examples of benefits under a universal healthcare system. I have universal healthcare in Canada. I even had to have surgery once a few years ago. It was a very quick and easy process. Because it was minor surgery, I had to wait just a few weeks to be able to, a few months to be able to get the surgery, but it was minor surgery. In America, the whole thing about wait times is hilarious. There's this whole false narrative around wait times in Canada or any universal system. Oh, there's these huge wait times. I talk with Americans. They also have wait times. So what's the difference here? The actual difference is that in Canada, if you need healthcare, if you need life-saving surgery, you're going to get it. You don't have to wait for that. Healthcare is delivered based on your need for the healthcare, not based on if you have money or not. So that is the main difference between America and Canada on healthcare. In Canada, you get healthcare when you need it. It's prioritized to those that need it. In America, it's prioritized to those that have money. That's the main difference here. So when it comes to, doctor visits, so a lot of Americans don't have this, but I can call my doctor the same day and have an appointment. So say I wake up, I'm not feeling well, I want to see the doctor. I just call the doctor's office in the morning. They make an appointment. I see the doctor later on the day. It's that simple. So there is so much misinformation out there about, these universal systems or wait times or whatever. Don't believe the BS. There is a reason why when all these countries move to a universal system, they don't move back to a private-based insurance, a private insurance-based system. If universal healthcare was that horrible, all of these countries would be going back to a different system. They're not. It's time to get with the times. America needs a Medicare for All system.